and other districts. And those of you who have endured your 3 hours of traffic jam this morning from Kampala, you're all welcome from all corners as you have come. My name is Rita Twehe. I'm going to be your host this morning. I'm the head of grants at Maristops and have been the RISE program manager over the past nearly 6 years. I would like us to start our day. We've already had a few videos and a few photos from the program, but would like, before we begin, we start with a prayer, and then after we'll do introductions. If you can please show the program. You have the program on each of your tables. If you have an iPhone, get your camera, point on to those very many dots, and you should have the program on your phone. If you have an Android phone, you need to have a code scanner. Please open it up, and you'll see those table talkers. They should be able to give you both the program for the day and the RISE program project brief. But for us to be all at the same time, we'll just have the program displayed now. And as you can see, we're a bit behind time, but we will be able to make up that time. We're supposed to have arrival and registration 8 to 8:30, and opening prayer and introductions thereafter, welcome remarks, then a presentation, a brief presentation on RISE, what is it we've been purposing to do and what have we achieved, and we'll have a bit of an interlude, and then go to a bit of learning, where have we been in terms of equity or inequity in SRH provision in the country. And we'll have some remarks from UNFPA, and we'll have tea. And then we'll have remarks from the outgoing chair of the Parliamentary Health Committee on some of the advocacy work we have supported as a program. And then we'll have remarks from the British High Commission. And then we'll have chief guest remarks. And we do have, at the end, some merit awards, which will be given out. I would like to welcome each one of you once again. And we'll start with an opening prayer. I don't know who'd propose to do our opening prayer. And I'm here looking for Jackie. Yes. Thank you very much.
Thank you so much. Can we humble ourselves and our word of prayer? Lord Father, we thank you so much for this great morning. We thank you for the great work that you've enabled us to do. We pray that you continue to grace us with the dedication, energy, and good health. We thank you for this great program that has been able to impact on people. We pray that it will be able to be sustained, and we continue to realize impact out of it. We pray for your blessings and favor throughout the day and the week. In Jesus' name we prayed.
So we'll start with the introductions, so that we can all know ourselves and especially where we're coming from. And if you can also just take a few seconds to say something that has made you happy this morning. And I'm going to start on this end, and I'll ask Sandra to have a microphone on that side as well.
Yes, good morning. My name is Aida Mwanguzi. I am the Assistant District Health Officer, Kalungu District. And I'm happy to meet people that I've worked with in the consortium. And I know there's a lot that is going to be shared today. Thank you.
Morning, everyone. My name is Anna Tukahirwa. I work as ADHO, MCH Karoro District. I'm happy because God has brought us safely. Thank you.
Thank you very much.
Good morning, all. I'm called Ruth Akurut from Abim District, a midwife from Ramuge Health Center 3. I'm happy to be here.
Good morning, everyone. I'm called Willie Florence Ochin from Abim District. I'm a midwife working as a district trainer for Maristop, Abim District. Thank you.
Morning, everybody. I'm Teresa Kello, ADHO, MCH, Abim District. I'm happy to be invited for this particular meeting. Thank you.
I would like to propose as they introduce themselves, if someone has traveled a longer journey than you, you clap for them. Okay? I think it is important we do that. So let's proceed, please.
I'm Olive Sentum, but I've just traveled from Kololo.
What should I say after that? Good morning, everybody. I'm Dr. Lidan Sekabembe. I work for PSI Uganda. I'm delighted to be here to share in the joys, the highs, and the lows of the RISE program as it contributes to Uganda's development. Thank you.
Good morning. My name is Batu Sajoy. I work with Clinton Health Access Initiative, also known as CHAI. I'm happy to be here, especially to learn about, the wonderful work that Maristop and partners have done in the space of reproductive health. Thank you.
Good morning, everyone. My name's Dr. Rachel Beajila from the Ministry of Health.
So this table are all from Kololo. So that's why we're not clapping for you. We'll take this table.
Good morning. I'm Dr. Gloria Kasozi from the United States Agency for International Development, USAID.
Teko Timothy from NAPAC, the District Health Officer.
Good morning, all protocol observed. My name is Natianga Sumta, ADHO NAPAC.
Good morning, ladies and gentlemen. Faith Nachirimba, DHO Masaka.
Good morning. My name is Mugabi Simon Peter. I've traveled the longest distance than any one of you here. What has interested me is meeting Malo from Karenga. So we've traveled together. Thank you.
Thank you very much. Pick this table.
Happy to be here. Good morning, everyone. I'm Chitimbo Patrick, DHO Iganga. Thank you.
Good morning, ladies and gentlemen. My name is Betty Chadondo, and I'm from Chadondo, so maybe I don't need to. But I work for the National Population Council, and I'm happy to have been associated with this program.
Good morning, ladies and gentlemen. My name is Nsibambi Douglas, working with FHI 360. We've been partners on RISE. Thank you so much.
Good morning, everyone. My name is Sanyu Kalibala. I'm the country manager of DMI. We were SBCC leads for the WISH program, but we worked very closely with RISE. Very happy to be here. Thank you.
Thank you very much, and good to see you, Sanyu, and colleagues on that table. I'll pick you.
Innocent Nkonwa, DH Allwell.
Rastomanji, DHMCH Rakai. I'm delighted to be here.
Morning, colleagues. Mlema Derek, EMMS Rakai.
Good morning, everybody. My name is Lydia Najemba Wasula, Minister of Gender, Labour and Social Development.
Good morning, everyone. My name is Jingo Ernest. I write for The Observer.
Over to you now.
Good morning. My name is Richard Obete, DHO Bunyangabu.
Good morning, Lucy Kabasinguzi, ADHMCH Bunyangaba. You're welcome.
Good morning, everyone. I'm by the names of Harriet Kabasomi, registered midwife from Bunyangabu district in Western Uganda.
Morning, everybody. I'm Bira Joy Bibian, senior nursing officer from Kasese, district trainer.
Yes, good morning all. My name is Frederick Mapombi from Makerere University of Public Health. I'm glad to be here and for allowing me to rise with you.
Good morning. I'm Jackie Katana. I come from an organization called Faith for Family Health Initiative. But for accountability, I'm here to represent the Reproductive, Maternal, Neonatal, Adolescent Health, Nutrition and Health Aging Platform, RAMNAC plus N, where we all belong in reproductive health. I also represent CSOs at global level on Global Financing Facility Investors Group, and FCDO is one of the key investors. Investors mean the donors who put money in the reproductive health. Thank you.
Good morning, everyone. My name is Noor Nachibuka Musisi. I am coming in from the Center for Health, Human Rights and Development, CEHAD, and I'm representing Ms. Fatia Changi. Thank you.
Thank you very much. I'll pick this table.
Good morning. I'm James Magezi Akiki, DMMS from Kagadi District.
Good morning, ladies and gentlemen. My name is Theodora Kajumba. I'm ADHO MCH from Kagadi District. You're most welcome.
Good morning, everyone. My name is Patrick Mujigo. I work with the Partners in Population Development, Africa Regional Office, that we acronym PPDR. And we've been one of the implementing partners on the RISE initiative, implementing the advocacy component. I'm glad to be here.
Good morning to us all. David Walakida. I'm representing Options, a RISE partner.
Good morning, everyone. I'm Grace Namata, Senior Program Manager at the British High Commission, and I've been the RISE Program Manager. Thank you.
Good morning, everybody. I'm Dr. Rita Wadimba, the Country Director for Pathfinder in Uganda and the Chief of Party for the USAID Uganda Family Planning Activity. It is humbling and a great privilege to be part of the RISE journey. Thank you for organizing this event.
Good morning, ladies and gentlemen. I'm Annette Kabarunji. I'm an Assistant Commissioner from Ministry of Gender, Labour and Social Development.
I'm here. Thank you very much. I'd like to pick this table.
Good morning, everyone. Tina Wamala, Communications Officer, British High Commission.
Good morning, ladies and gentlemen. My name is Maureen Katende, and I'm the Program Manager at the British High Commission, UK Aid, FCDO, call it what you want. And yeah, I'm happy to be here, and I've been the Program Manager on RISE.
Good morning, everyone. I'm Ian Ayevare. I work with the British High Commission as a monitoring and assurance officer.
Good morning, all. Happy to see you all. I'm Brenda Kabibi Tumsime. I'm a policy officer with the British High Commission.
Good morning, everybody. I'm Margaret Aricha, program assistant for this program. I'm happy to meet the RISE team, to see the faces. I've been working with you in the background. Thank you so much.
Thank you. I'll pick this table.
Good morning, ladies and gentlemen. I'm called Sheikh Semwanje Nassa, and I'm the Secretary for Public Health, the Muslim community.
Good morning, ladies and gentlemen. My name is Eva Nachimuli. I work with PPDRO, Partners in Population and Development, the Africa Region Office, a RISE Consortium member, and I've been the coordinator at PPDRO as we were pursuing policy and funding advocacy.
Good morning, everyone. My name is Lilian Nabatanzi Subuga. I work with the Parliament of Uganda. I coordinate issues of reproductive health with the members of Parliament.
Good morning, ladies and gentlemen. My name is Mwima Rebecca, and I work with PATH.
Can I pick your table? I'm good to see you.
My humble greetings to you all, ladies and gentlemen. I'm called Dr. James Lemcol, the District Health Officer, Moroto.
Good morning, everyone. Chobija Monica, District Trainer, Wakiso.
Yes, good morning, everyone. I'm Namtos Juliet. I'm a nurse. I work at Wakiso. I'm at Wakiso local government. I'm a family planning provider. Thank you.
Hi to everyone. I'm Dichiru Christine from Koboko District. I'm the proprietor of Koboko Hope of Glory and the service provider. Thank you.
We should also all be clapping because I think she's traveled the farthest, isn't it?
Good morning, ladies and gentlemen. I'm Lilian Sanyu Kebirungi Samantha Amoti. I'm here to represent the Kingdom of Toro. I'm the Youth Administrator of the Toro Kingdom Youth Ministry. Thank you.
I am also called Abwoli, so that if you don't know that, it is captured. But good to have you.
Good morning, ladies and gentlemen. I'm Nachitio Costancio, Assistant District Health Officer in charge of maternal and child health, Luengo.
Good morning. My name is Christine Mugerwa Kasule, and formerly a minister in the Buganda Kingdom, in charge of cabinet and Luchika affairs. I'm happy to be here. I've seen some people that we have worked with in the past. Dr. Betty Chadondo, I heard her introducing herself. So I'm very happy to be here and see them once again. Thank you very much.
I also have a name, but we'll talk about it later.
Good morning, colleagues. Call me Adil Florence, ADHO Maternal Child Health from Koboko District. I don't know how many of you have ever reached that place. I'm happy to be here.
Good morning to you all. My name is Draru Jessica Andrea. I'm Assistant District Health Officer for Maternal Child Health and Nursing for Maracha District Local Government. I'm happy to be here.
Good morning, ladies and gentlemen. My name is Lamiru Lois. I'm a midwife and district trainer from Koboko District. I'm happy for Rice and Mary Stop to make me feel at Serena for the first time.
Good morning to you all. My name is Sechanzi Adrian.
appropriate and young medical services, that is in Nchengera Town Council. I'm also delighted to be here. I myself am a testimony, and I've come here to testify for the good services RISE has brought to the communities we serve. Thank you.
Morning, ladies and gentlemen. My name is Betty Nabuganda. I am an Assistant District Health Officer in charge of maternal and child health in Wakiso. I think I've traveled the longest jam.
Yes, the longest traffic jam, I agree, and it's a Monday morning, so yes, you're most welcome.
Yes, good morning, ladies and gentlemen. I'm Dr. Kwairo Justin, DHO Nebi.
Good morning, everyone. I'm called Ovonji Patricia, enrolled midwife, service provider.
Good morning, everyone. I'm Irene Nandutu. I work with Population Meeting Center, partner of RISE.
Good morning, ladies and gentlemen. Becca Achid is my name, substantively as Assistant Event Management Officer for Health, Maracha District Local Government, and also given the assignment of District Medicine Management Supervisor. Thank you.
You're most welcome. I'll pick this table here.
Good morning, everyone. My name is Angela Ogera. I work with Mary Stops as the Director in charge of social business.
Thank you.
Yes, good morning, everyone. Martin Agawa, Head of Programs, Mary Stops. You're most welcome.
Good morning, I'm Benson Muhindo, and I work for Rich Hand Uganda as the Head of Programs. And we were part of the RISE program as the youth partner. Thank you.
Morning, everyone. I'm James Kasuja, the RISE Finance Manager, Marisops Uganda.
Good morning, everyone. My name is David Kamu. I work as a team coordinator at Maristops.
Thank you very much.
Good morning, everyone. My name is Joshua Mirondo, and I work with Communications and Advocacy Department at Maristops Uganda. Thank you so much.
Good morning, ladies and gentlemen. My name is Arini Twesandra. I work with Maristops in the Communications and Advocacy Department. Thank you.
Good morning, everyone. My name is Susan Obalim. I work with Maristops Uganda as the SPC coordinator for Midwestern region.
Thank you very much. We have covered all corners, and I'll check for teams that I haven't recognized, I think who came in a bit later. And yes, please, Dr. Gizamba is here. If you haven't introduced yourself, please let me pick you quickly and then we can begin. Dr. Gizamba.
Thank you, Rita. Good morning, everyone. You are welcome. My name is Robert Gizamba. I'm the Finance Director of Maristops.
Good morning. Nice to see you all. My name is Ronald Ahirire. I'm the Country Director, Population Media Center, and we were a partner on the SBCC component on the RISE program. Thank you.
Good morning, everyone. You're most welcome. I'm called Irene Among. I work with Maristops. I lead the contact center. So basically here is our exhibition table, sorry. We have our products. We have our IEC materials, the cards, the brochures, the bumpers. Then we have our annual report. So please feel free to pass by and have a copy of yourself. Thank you so much and have a lovely day.
Thank you very much, Irene. And you're all most welcome once again. for all of you that we saw when we had our regional engagements, starting with the West Nile team. Colleagues from West Nile, please by show of hands. We've had several districts. Thank you very much for that long journey. And the team from Karamoja. And Dr. Migai, when you are aware, I said I have another name called Awole. So that you had. Okay, so you're most welcome, sir. The team from Eastern, do we have any colleagues who've traveled from East? Central, and the team from Central, Wakiso, Masaka, Lwengo, Rakai. Okay. The Western region, Fort Portal, Chenjojo, Bunyangabo, Kasese. Thank you. You're all very most welcome. We met most of you when we had the regional closeout meetings last month. And the team from Kampala with your traffic jam and potholes that has taken you 3 hours to arrive. You're most welcome, colleagues, in this place. So on your tables, you have table talkers, which have both the program, but also summary of the RISE program. So please use your phone to scan and get the program, which we are also showcasing now, but for later on. You have on one side this, which says can't read fact sheet, and on the other side, scan for the event program. So if you can use your phone to scan, if you're using an Android phone, you need a scanner app. You point it there and it will read it and there will be a link. If you're using an iPhone, use your usual camera and it will give you the link. Please click on that link and then you have the program. And we have IT colleagues who can support those of you who are not able to get that. But we'll go through the program as well for your comfort as well. So we have completed 2 items and we just completed opening prayer and introductions. We will have welcome remarks and then a presentation of the RISE program. And then a bit of success stories and videos which will play all throughout the event. And then we'll have a bit of learning from the PMA team, evidence on informed FP programming and addressing inequity. And then we'll have a question and answer. We will later on have remarks from UNFPA on general reflections on the HRS space and progress that's been made with emphasis on the FP 2030. And thereafter, we'll have remarks from the British High Commission and our chief guest who will come in at a later point to also give us remarks. And finally, we will have some merit awards to give for the performance across the regions and impacts that we've seen over the past 6 years on RISE. So you're most welcome once again. And please feel at home. We have teas. Those of you who had tea, I think tea is now done, but there is water on your tables and there are some mints. And then we'll be going on with our program. I would like to acknowledge in a special way, a few guests who, again, we'll introduce later on. But we have a Medistas, the Development Director from the British High Commission. Mr. Philip is here with us. The Honourable Member of Parliament and our outgoing Chair of the Health Committee, who we've worked very well, Honourable Dr. Charles Ayume is here with us. And the colleagues from Ministry of Health, Dr. Mugahi, who's here. Dr. Rachel had already introduced herself, but she's also here, Dr. Rachel Beagia. Our Senior Country Director, MSI Africa, Dr. Carol Sechimpi, will be coming shortly and will introduce at that point. And the RISE team, and also in particular our team leader, Dr. Peter Dungu, and also Deputy Country Director, Mary Stopes, are you most welcome. Without further ado, I would like to go to our next agenda item, which is remarks from, welcome remarks from MSI, MSI colleague, Dr. Carol Sechimpi, Senior Director, Africa, to give us welcome remarks. Thank you very much.
Your Excellencies, distinguished guests, ladies and gentlemen, all protocol observed, good morning. We serve breakfast. Good morning. On behalf of MSI UK and on behalf of Mary Stopes Uganda and on my own behalf, it is with great pleasure and a deep sense of accomplishment that I welcome you to this occasion where we are going through a learning event and a transition event for RISE. This gathering marks a culmination of almost 6 years of hard work, of partnership, of collaboration, of learning for the well-being of Ugandans. Back in the day when we started out, about 2016, when our MSI's main intervention in the public sector was outreach, mobile outreach, I remember having a conversation with my team where I said to them, please greet. When you go to a public health facility, greet the gatekeeper, greet the in-charge, greet the nurse, greet the stores keeper before you start doing your service delivery. And I'm really amazed to see that 6 years later, this greeting has culminated into mentorship, into skills transfer, into deep partnerships in line with our public health strengthening program. No wonder the UDHS of 2022 reported a 3 percentage point increase in modern contraceptive prevalence rate. Now, 3% sounds like a small number, but it is not. For a population that is as young as ours, where every year you have multitudes turning of reproductive age, it takes a concerted effort at all levels to be able to achieve that. And while we acknowledge that there are regional variations and stubborn problems like teenage pregnancy, I think those of us who've been part of RISE have good reasons to celebrate. I want to take a moment to recognize each one of you, our esteemed guests. Thank you for coming. I want to recognize representatives of the government of Uganda, representatives of the Ministry of Health in all your respective capacities, all the way from the minister who's not here, the permanent secretary who I expect to come. The permanent secretary of the Ministry of Health has been such a champion on RISE. Working behind the scenes, she has held this project together and ensured that it is delivered seamlessly. We've also had a champion in Dr. Charles Solaro, who's not here again. We thank him for his contribution. Each of the district health officers, each of the ADHOs, each of the service providers who've taken our mentorship, each one of you representing the government of Uganda, we welcome you and we thank you for your partnership on the RISE program. We also want to acknowledge the partnership and support of the Parliament of Uganda through the Health Committee. When we started out, we were working with Dr. Michael Kenya, and then we received Dr. Charles Ayume and his team. Thank you very much and welcome to this event. Our donors, the British High Commission. Philip, you're most welcome. There are several members of the team from the BHC who I see on this table. But I'd like to single out Grace and Arnold, who have been our partners in troubleshooting and just keeping this project on the run. This project has gone through unprecedented challenges and opportunities. Most challenges are also opportunities. Like the COVID era, 2 years of freeze, and yet we continued to deliver services. And this was because we were troubleshooting through our donors. Thank you very much and welcome to this event. Our RISE partners, members of the consortium, Rahu, our youth partner, Population Services, PTD Arrow, welcome. FHI 360, welcome. Options, welcome. Population Media Center. And while I was reflecting about today, I remembered our fallen colleague, Patrick Lubowa, the late, with whom we started out on RISE, and I hope each of you will take a moment to think about him and his contribution, and also our colleagues from Makerere University. Dr. Makumbi, thank you, and you're most welcome to this event. You know, there's a saying that if you don't have reproductive health commodities, you don't have a family planning program. So I'd like to acknowledge our partners in supply chain, the national medical stores and the joint medical stores, even though they are not present in the room. I'd like to acknowledge all of the other donors. I had a representative from USAID and other implementing partners, my colleague Lillian and others who have worked with us on many forums. There are many fora where we sit and talk about SRHR, and it is that collaborative effort that has enabled us to be able to deliver RISE. Last, but by all means not least, I'd like to invite you to join me and put your hands together for our RISE team leader, Dr. Peter. Dr. Peter has given us firm leadership through this project. Normally at MSI, we would fly in an expatriate to do a job like this, yeah? But Peter, who's our own board and bred here, has done it. And Peter, we acknowledge you and thank you. Congratulations on RISE. The next presentations are going to delve into the technical matters of RISE and the learnings therein. But for me, from where I sit overall, RISE has been a great success. The British High Commission has scored us A+ each time they come to check in terms of our delivery against KPIs. But more importantly for me is the partnerships that we have built, the skills base that we have built, and the movement of Ugandans at all levels whom we have recruited. Ugandans who understand that enabling women to choose the number and timing of their births not only saves lives, but is also a cornerstone to national development. As such, while we're closing the chapter on RISE, I'm really not anxious about the future. In fact, I'm excited. I'm excited about what next, who next, with who next, we do more for our country. Once again, I thank you all for joining us at this event, and I invite you to enjoy the rest of the program. Thank you very much.
Thank you very much, Dr. Carol Sachimpi, who we started with as our country director, Maristopes, at the beginning of RISE, and then to senior country director, looking after several countries, and now our MSI director for Africa. So thank you very much for those remarks. And another hand clap for Dr. Carol. Would like to acknowledge the presence of Dr. Kamara Nicholas, who's been delegated for the incoming chair of the Parliamentary Health Committee. But we've also worked with Dr. Kamara in his capacity across RISE in advocacy areas. So very good to see you, Dr. Kamara. I would like to now, as we wait for the next presentation from the RISE team leader, acknowledge and request that each of the RISE consortium partners stand up for this recognition. And I'll ask you to come here as Dr. Peter prepares his presentation. RISE has been an adaptive program starting in 2018. delivered through a consortium led by Maristops. And Dr. Peter is going to take us through that. But alongside those partners, would like to recognize, first of all, the RISE core team. Dr. Peter has already been recognized, but I would like to recognize Mr. James Kasuja, our RISE finance manager, who's kept us afloat across the very complex contract, a performance-based contract that has fees, that has KPIs, but to make sure that we are reporting correctly across the consortium. You're welcome, James. I would like to also acknowledge now the partners. I'll start with Population Media Center. Mr. Ronald Ahirire is a country representative for Population Media Center. Please come forward. And they delivered a very innovative program, Sotakai and Akakunizo, the first of their kind, which was radio serial dramas in English and in Luganda. They're available on YouTube, so courtesy of the RISE program, they've been able to make them available even after the program. They're very educative. They span the entire SRH scope, GBV, etc., in an edutainment format. So thank you very much for coming, Ronald Ahilire. And then I will pick FHI 360. I don't know if, Douglas is here. We had also been expecting Dr. Nathan to come, but Douglas and Svambi. FHI 360 have been on RISE, our SBCC technical assistance, providing and leading on interventions that are around behavior change and what are the things we should be doing and adapting each year. So you're most welcome, Douglas and Sivambi. And then we'll have Makerere School of Public Health, Professor Naz, I've seen you walk in, who have led our RISE research and learning, all the way from the formative research, the resource mapping that determined where we're going to go in terms of regions, to baseline, midline, and endline surveys, and making sure we're actually doing interventions where we need for equity. So thank you very much, Professor Naz, and he was alongside Professor Makumbi as well, who's also from PMA, and he's here. I will then pick Richer Hand Uganda, who are a youth partner, but also the partner for whom were mandated to build capacity to grow as an organization on RISE. So as they were delivering work in terms of the scope for young people and interventions for young people, MSI was mandated to also make sure their systems at the back are more sound, and we've seen them grow to the improvement. So Benson is representing Richer Hand Uganda, and he's a program manager. Head of programs. And then later on, we got added or started working on the advocacy component in 2021, and two partners, Options Consultancy. Mr. Walakera David is here, if you can please come up. And these colleagues were supporting subnational accountability mechanisms, but also advocacy at subnational levels. And they were mandated to support rapid engagements in 15 priority districts, Mr. David Walakera. And then PPDR, Patrick is here. They supported a significant amount of work on the advocacy at the national level, but also building capacity of civil society organizations within the RAMNAC platform to advocate beyond the big partners that we have here. And they built capacity nationwide, doing trainings for civil society in all the regions, but also at national level. We had the dance between the SRH policy, the ADH policy, and then health policy. We had a bit of a dance and working really hard around the National Health Insurance Bill, and they were leading on RISE with that and working with the Parliamentary Health Committee and most of you colleagues here. So I will invite the RISE team leader, Dr. Peter Dungu, to say a few remarks and acknowledge these colleagues, and then afterwards we'll sit down. But thank you so much. So these here represent the different entities, 6 entities, who have delivered RISE alongside the Maristops group. Maristops team led the consortium, and these provided particular expertise and additional support to make RISE what it is. So as Dr. Peter goes through what we have achieved, for each of those indicators, I thought it is important for you to know the partners that we've worked with to be able to deliver this work. Over to you, Peter.
Thank you very much, Rita. I will say a few words shortly about Rita, but building on Dr. Carroll's protocol, good morning, ladies and gentlemen. Thank you very much for coming. The team here, as Dr. Rita has introduced, I would just like to assure you we've had a lot of support from you guys. There's been a lot of innovation in the RISE program because of the consortium partners we've had. And so whatever we'll share very shortly, please understand that Maristops hasn't done this alone, but we've had a very strong team with us. So thank you very much. And it's been a pleasure working together. You may please take your seats. Rita introduced everyone on the RISE team within Maristops except herself. Rita works as the senior program manager for RISE, but is actually our head of grants. And she's really been the muscle behind RISE. You know, the detailed thinking, the implementation plan tracking, pulling things together. RISE as a performance-based contract is a very complicated way of calculating results and how you'll get paid. And so Rita has been at the back of all that. As you heard, we had a lot of ups and downs. COVID led to a few hiccups, and we had to rethink. And at the back of that, we've always had to pivot and think. And Rita has been, you know, behind the scenes pulling all of us together. And so, Rita, thank you very much. Job well done. And it shows this morning. So whatever you see that is good is Rita and the whole team behind her. We also have people who are not here because we could not bring everybody from Maristops. The people who support the team you've seen today, some of whom are outside at the registration tables. We also want to acknowledge all our internal teams in service delivery and the other things. Right, so we are running behind time. I will try and run through the next presentation, which is about our results. So if you just... there you go. Okay, brilliant. So I'll go to bed tonight having learned one more thing. I'll be a better person. Right, Rita has mentioned a lot of the information on this slide. That money was a little bit less than that at the beginning, about 26, I think, million pound. But we've been fortunate to have cost extensions as well. RISE was supposed to end in December last year. And yes, we thank the British High Commission for making this funding available, but also for, giving us the consideration to close in August. So this month, this program will be done. Now, the intended impact in the design of this program was to reduce maternal mortality. And this would be done through, increasing uptake of modern contraception. And it is very pleasing in a country like ours to firmly have something to address maternal mortality. And of course, increasing the uptake of modern contraception, which, as we all know, is the first pillar of the 6 pillars of safe motherhood, family planning. And it was hoped that we would achieve this working through 5 outputs. One of the things I'm very grateful for is that as part of writing our proposal for RISE, so it's very pleasing when you sit and write things on paper, and then you implement them, and then you begin to see some of the results, as we'll see later. But in output 1, we knew we had to work around awareness of the benefits of family planning. Output 2 looked at producing actual services to increase the availability of the modern methods of contraception, and this through not only the public sector but also the private sector. Rita mentioned about commodity supply, so we didn't work alone. We knew we'd have to work with other people on that as well. And we know there's an environment around, the provision of these services. So that too has been part of this program. And output 5 looked at the data. Family planning data when we started was terribly patchy, really way behind where, for example, HIV data is. Those of you who sit on the family planning technical working group will know about 2-3 years back, we had to sit together and say, but we need to do something a little bit extra around the quality of our meetings, what we are tracking, can we agree on a few indicators? So it's not been something we're doing alone as RISE, but within the sector it was felt there's something we need to do around our data. I will skip the consortium and its management because that has been already spoken to. Now, when RISE was awarded, it was initially, when we wrote the proposal, it was to cover 6 regions out of the 10 then. Of course, the UBOS regions are slightly different, but 6 out of 10 was the initial thinking that RISE would cover. So whatever you see as white was not part of RISE. So the regions that are white have not been part of RISE. But that's not to say FCDO did not have funding in the country supporting those regions. For instance, over the same period of time, we had the WISH or WISH 2 program as well, and I've seen maybe IPPF or Reproductive Health Uganda is not in the house, but I know, for instance, SANU on DMI was part of that consortium. So WISH was implementing in also with FCDO money in some of the other regions. Now the difference in the colors speaks to the depth of the implementation of the initiatives that were being supported. But I want to make a comment. We had to do a resource mapping and an assessment at the beginning. And we then realized that West Nile, which was not initially part of the program, did need support, and it was brought onto RISE. West Nile was initially not a region identified for RISE. And I would like to acknowledge Dr. Rita Wadimba, who was our senior responsibility officer then, because she was stewarding over these decision makings, where we should go, where we should implement, what we should do where. Now, the purple and dark purple is where you had all the interventions. So we were working to support the public sector, the private sector. We're doing SBCC work. And some of our partners, they specialized reaching out to adolescents. That's the deep purple and the purple. Now, the very light purple is where we only had outreach and social franchise, mostly Eastern Uganda. And we did not do public sector strengthening work there because we were overlapping with the WISH program. So again, one of the things we've, experienced during this implementation is adaptive programming, where you say, okay, resources are better spent with that partner. And so in Eastern Uganda, you will see we did not do the public sector strengthening mentorship. All we did, and then had to, leave that to RHU and IPPF. I would like to talk a little bit about the work that Options and PPDRO worked on, but probably I'll do that on another slide coming up. So I've talked about the interventions. So let's look at the public sector strengthening work, which we did in 42 districts, where we had up to 325 public health facilities, just over 750 health workers, under a comprehensive on-job mentorship. And the beauty of that mentorship is that it is not delivered by Maristop's staff alone, because at the beginning we realized that it was important to recreate people like Maristop's in the district pool to continue the training. So we are particularly pleased that you've seen ADHOs. Every ADHO you see in this hall has the clinical skills to provide a long-acting reversible contraceptive method. They can insert an implant, an IUD, they can remove them, they can supervise the people, because they had to be taken through a TOT. Every ADHO in these 42 districts had an additional 2 people we call district trainers who went through this training. And then alongside our Maristop's regional training officer, we could then go down to the facility level to do a need-based on-job mentorship. So I wish the PS was in the room, because long before there was a concern about hotel-based training, we knew under RISE that we had to do the training on job in the facilities. And so even as we, as Maristop's, end this, we know that in each district there is the capacity to do what we do. The capacity to train health workers is there. The other channel we use for service delivery is we had 20 outreach teams which work every day except for public holidays and weekends, rotating through districts. Each outreach team supports about 6 or so district clusters, and we target outreach at the lowest levels, Health Center 2 and Health Center 3, because we know that the public health system does not have the numbers that are required to, provide optimal service. And when outreach goes there, we do not work alone. Again, we try and pass on skills with the midwives there. And you've had a few of them in the room. In the private sector, this British funding has helped us to run a subsidized voucher where at accredited private sector clinics, and I've seen one of them, the proprietor of Nyange Clinic is here, for 2,000 shillings, for 2,000 Uganda shillings. So a community, we would work with community-based distributors. They would identify, vulnerable people in the communities. For 2,000 shillings, the community member would take the voucher to a private sector that's accredited and redeem a service of their choice. Might be an implant, might be an injectable, might be an IUD, might be a permanent method, whatever it was. And still on that same voucher, you had 3 other visits for review and for removal of that method. So the support to the private sector through that voucher has really helped, especially to improve adolescent uptake. We had 2 types of voucher. The 2,000 shillings one is what I call the hardship voucher. And then there was a free voucher for adolescents, the under 20s. So RISE has been very impactful in reaching adolescents through the private sector because income is a barrier for particularly the young. And those 114 private clinics are in about 68 districts. We know that we've also trained people there, and that work will continue. We've worked in demand generation. Rita has talked about our work with PMC on that radio serial dramas. They ran for just under 2 years, and it helped with awareness. Moving forward, these are some of the numbers we've reached. You can see our coordinator there talking to people at work in their gardens. That's all about the door-to-door, getting the message out, whether you're using the traditional VHTs or peer VHTs or peer educators, whatever the name is, you need people going door-to-door in the community. We've reached 4.3 million individuals with SBC messages. I've talked about health workers who are mentored in the provision of these family planning services. Just over 750 of them. And the mentorship covered 3 core areas: the clinical skills, the stock management, and data management. I won't go into details, but when FCDO would score us every year, there was an objective way of assessing the clinical skills and assessing how well the data management or reporting has improved, as well as stock management. We know 2.4 million individuals have accessed contraception, and up to 5 million contraceptive services have been provided, generating up to 6.3 million couple years of protection. I just want to talk a little bit about the contraceptive service. In there, we include counseling, because good counseling is a family planning service. When you look at our Method Information Index, one of the reasons we struggle with myths and misconceptions around family planning is how, for instance, side effects are managed. And good side effects management starts with the quality of counseling at the start. And some of the nurses here would testify what has been different when you are trained to do this well. Now, I'll run through the details because we cannot just speak words without the numbers. So I'll quickly run through how the British High Commission has been measuring our progress every year, and now at the end of project. They are called milestones. So the project milestone, for those of you in the non-FP world, those are targets. In the FP world, we don't use that language. We have milestones or projections. So we had a milestone on our impact indicator, reducing maternal mortality. And at that time, we had the 2016 baseline, you know, the 336 deaths per 100,000 live births. And so we were among the happy people when we saw that UDHS 2022 results released, indicating that maternal mortality had, you know, come down to 189 deaths per 100,000 live births. Now we know we are not the only people contributing to this. As I said, family planning is only one of the 6 pillars of safe motherhood. But we like to think we have had a lot to contribute to what this country has been able to achieve on that milestone. And so you can see that was a 43.7% reduction on the impact indicator. We had some outcome indicators, two of which we have exceeded, the ones in green, and one of which we are still behind. We don't know where that number will be when the end of project, you know, evaluation is done. Sometime, I think, in September. I'm looking at Grace. I think sometime in September, that's when we'll have the final figures in. But the contribution to unintended pregnancies is derived from what we call an impact calculator. So the services you've provided are put into basically a modeling tool, and then one sees at probably how many unintended pregnancies will be averted. That's the correct language. So we know up to about 46% of pregnancies in this country are unintended, and that figure is higher for adolescents. So we can see what contribution the program has made. The high impact clients are adolescents, those living in poverty or multidimensional poverty, and adopters, who are people who've not used the contraceptive method for at least 3 months before taking a method. And that's the number where we are below the milestone. But like I said, we don't know where that number will be at the end of the project evaluation. out of the awareness or SBCC indicators, the ones in green, we've been able to achieve the milestone. In other words, people reached by an SBCC message and those reached by an actual community health worker.